Okay. Feed your mind, feed your body, feed every part of you. You need yourself to be in good health. And that's one of the reasons we talk about the topics right here on Soul Food on Smooth 98.1, because we love you, not just music. We love life, and that includes your life. That's why we are here to educate you. My name is Oluwaseun, and Soul Food runs every Saturday morning from 8 a.m. till 8:30, talking about your health and wellness. I said it earlier, I think around 7:09 or thereabouts, saying that the topic this morning is one that has been called Jedi by a number of people. And of course, Jedi is Jedi in my own words. So is Jedi really piles? And what is hemorrhoids? Are they the same? We'll be getting all into that in some few seconds. But before that, let me let you know that we are streaming live on YouTube. It is youtube.com/smooth981FM Lagos. youtube.com/smooth981FM Lagos. So not only do you get to view what's going on in the studio, see my face and that of my guest, you also get to drop your comments or questions, whatever it is that you like to say in the course of the conversation. Aside that, you can participate by sending your messages to 0809-444-0981. That is the WhatsApp line, and we do not take calls on that line. But if you like to dial our number and speak literally, 01448-9981 is the number to dial. And you can tweet us on Twitter at Smooth981FM. So joining me via Zoom to discuss the topic of piles, the causes, the prevention, the symptoms, and of course the treatment is Dr. Niiyin Adejuyigbe. Good morning.
Good morning.
I got the name right?
You did, yes.
Thank you. How are you this morning?
I'm doing well. How about you?
I am fine, thank you. So quickly to the basic. First, let's understand what exactly piles is, because I know that a number of people call piles Jedi or Jedi
Yes.
in my own lingo right now. So what exactly is piles?
Okay, so pile, commonly called, also known as hemorrhoids, is when the inner lining of the inner canal swells up. The inner canal is where we defecate through. So where poo cut that hole, and the canal where poo comes down through. That's the inner canal. So when the inner lining swells up, that's what we call pile.
That's it?
That's it.
What about the pain? What about, some talk about blood. Is that hemorrhoids? Is that when it becomes hemorrhoids?
No, pile, same thing.
No, I didn't get what you said just now.
Pile and hemorrhoids are the same thing.
Oh, they are the same thing.
They are the same thing.
Ah, interesting. So what causes that swelling exactly?
Okay, so we have a network of veins, blood vessels in the around the inner canal. So sometimes too much blood gets stuck in them and it cannot return back. So then it causes a swelling.
So what causes that too much blood to go to the veins such that it can return to the body?
Okay, so there are some hereditary causes of that, but the actual cause of that, we are not sure. But we have risk factors that predispose people to having such experiences, to having piles.
Before we even go to those risk factors that you might want to say, I have some tons of questions as a result of things I have heard about piles. So I'll be asking you one after the other. To begin with, is sitting on the toilet seat for too long a risk factor?
Yes, it is, because of the posture you take while you're on the toilet seat.
What do you mean the posture? I'm sitting on the chair right now. What's the difference? Or is it because of the hole?
No, but most people are not sitting erectly when they are bending forward, almost taking a squatting-like position.
Oh, so it's that posture.
Yes, but because when people are on the toilet long, they are straining, they are pushing hard for the poo to come down. And that is one of the major risk factors of getting pile.
Okay. Like I am a 5-year-old now. On the other hand, or on the one hand, the sitting posture, they are bending forward, right?
Yes.
They are not sitting straight. That is a risk factor.
Yes.
Then they are straining.
Yes.
Oh, so pushing. So it means that we need to soften our waste product of metabolism.
Exactly. And how do we do that? By our diets, by what we eat. So I suppose, can I just go on, or you still want to ask questions?
Yeah, before you go on, there are some things I'm deliberately asking this question so that people are very clear because there are a number of things we have misbelieved or wrongly believed about this.
No
Now,
problem.
when you talked about diet, has anything sugary or as sugary things, because it is said that when you eat too much sugar, then you have jedi. So sugary things, the consumption of sugary things, soda, basically sugary things, is it a risk factor for
It is not.
piles?
It is not.
Wonderful. Okay, now that is the one side of it. The other side is, does piles actually come with backache or
Um,
pain?
it can, but it is not a consistent symptom that we see with pile, but it can.
Hmm. Please go ahead with your explanations.
So maybe as a result of your sitting position, or as a result of pushing hard, or as a result of a cause of pile, you feel back pain. For example, anything that is in the abdomen that is not naturally supposed to be there. So let's say a tumor, a pregnancy is increasing the pressure within the abdomen. That can cause back pain. That can also cause pile. It's not
Hmm.
the back pain, it's just the cause. They just have that similar cause. Do you understand? All right,
Yeah.
thank you.
Wow. Okay. That is very enlightening and it is a good place to start. So we will take a short break. When we come back, if you have any questions or you have a disagreement, a disapproval as a result of what you just heard, please be our guest. 0809-444-0981. You're listening to Soul Food right here, and we're talking about piles, the causes, the risk factors, the treatment, and of course, the prevention right here on Smooth 98.1. So we have a minute plus break, and after that, we come back and we go back again to the beginning just for someone to have more idea. So I deliberately used all of that to make someone, because I know the things I heard while I was growing up and how people, in fact, maybe that's where we start from before you go back to the explanation. Some people even take different herbal mixtures and concoctions in order to prevent in advance.
Yes. That is
Jedi.
it. I want to target that one today, actually.
Beautiful. So when we come back from the break, we will start with that and go on as it comes.
Right.
Turn that fear into victory. What are we doing today?
Smooth health on the drive. It's a global competition that helps raise people's awareness. Discussing health matters that concern you with relevant information and tips from medical experts for optimal well-being. How to prevent this effect or treat it. Tune in every Thursday at 5
All right, we're coming back.
on the Smooth Drive. So, if you didn't know, now you know.
If you did not know about piles before now, you are getting some information about it. But before then, we have Smooth Health that runs on the drive every Thursday from 5:15. We do not just have soul food that educates you about your health and wellness on a Saturday morning. We also have something for you who are on your way back from home every Thursday. We talk about your health. So please set a reminder. Now, that said, we are talking about piles. I can say that 100 times, which is popularly known as Jedi. Here we are discussing what it is not, the risk factors, and we have itemized some of that. My guest is Dr. Niiyin Adejuyigbe, and we are streaming live on YouTube. You can join us on youtube.com/smooth91FM Lagos. We have told you some of the risk factors. Your sitting posture on the toilet seat is a risk factor, and the diet that you have. If you have those hardened waste product of metabolism, that could also first the nerves and, cause the swelling rather. Then let's talk about people who treat this thing in advance. When I say this thing, just know that. In fact, I think I will call it JJ this morning, so I don't go about saying JD or Jedi. People who treat JJ in advance, saying, well, I have back pain. I've taken so much sugary things. I feel I will have JJ soon. And then they begin to drink lots of herbal potions and concoctions. Should that be a thing, Dr. Nee?
Okay, so first of all, even eating a lot of sugary things in the first place does not predispose you to piles, as we've earlier said. But treating piles with herbal concoctions, or agbo, as it is locally called, is not sufficient. It doesn't even work. Let me explain to you what we need in the herbs, what we need from our diet as is high fiber content. And what we mean when we say high fiber content, we mean lots of fruits and lots of vegetables. Fruits like carrots, like mangoes, red apples, banana, avocado, vegetables like potatoes, like corn. But the issue with herbal concoctions is, don't they boil these vegetables and they drink the liquid from it? What you need are the roughages. You actually have to chew and ingest. That is what makes the poo soft and moves easily through your bowel. The nutrients alone are not sufficient to treat bowel.
Okay, thank you for that. Wow, okay, so now you know what you should be doing in case you want to boil your herbs and your herbal concoction. So what you need more is the fiber that helps you to soften your waste product of metabolism.
Your vegetables, you don't drink them.
Is that?
In this case, you eat your vegetables, don't drink them.
Eat your vegetables, don't drink them. And one of the scary things about those concoctions is that they need alcohol to extract the juice from it. So because of that, you're also consuming alcohol, and maybe it might take a toll on your kidneys. So please be careful what you consume, just for you to prevent in advance this JJ. Please, and please be careful. Another thing is, at least it's one thing for you to collect all the ingredients yourself. It's another thing for you to go out there and buy it. Because everywhere on the streets of Lagos, you tend to have people who have those annoying and ugly looking megaphones screaming and telling you to come and buy something that looks really scary in a bottle that is usually dark, for you to come and wash or cleanse your blood. What does that even mean? They will say, come on.
So many times.
What is washing your blood? How do you wash your blood? No.
I think I think what people mean is that they feel like they've eaten too much junk food or taken too much minerals or alcohol, and they just want to cleanse themselves. So I think that's why they think herbs are the solution. I'm not really sure why.
Now that you mentioned it, please quickly help clarify. So when you take something bitter, does it serve as an instant balance for taking the sugary thing? Because that is the belief.
No, it's like saying you put 2 big spoons of sugar in a cup of water, and because of that, the sugar content in that water has gone down. You just taste the sugar less, but the sugar content is still the same.
So if I take 2 tablespoons of sugar and I immediately take bitter leaf juice, am I fine?
I cannot speak assertively on that because I do not know all the benefits of bitter leaf juice. But what I do know is that if you do take sugar, the sugar is already inside your system. Taking bitter leaf juice, it does not remove the sugar. I'm not sure what that's the benefits they had from bitter leaf juice. So I cannot really speak expressly on that.
Thank you very much for the help and the clarification. I hope somebody is getting at least one new information or the other. So let's talk about the symptoms of piles. How do you know you have piles?
All right. So the things you see or notice about yourself that'll make you say, I think I have piles, or I think I should see a doctor. The first thing is bleeding from your anus. And it's important to know that there are things about this blood that stand out. Number 1, it is bright red. Number 2, this blood is not mixed with your poo. It comes after your poo. So let's say you're on the toilet, you finish pooing, then there are like drops of blood, bright red blood into the toilet blue. We call them a flash in the palm. Or you're wiping yourself with tissue paper and you look and you see bright red blood on the tissue. That is one of the first signs. That is one of the first symptoms that you notice. The second thing, but I must point out that sometimes This bleeding can also be as a result of more severe issues. So please visit the nearest health facility to get examined by a doctor. The next thing you notice is there will be swelling around your anus. Sometimes this swelling comes out only when you defecate, and we'll get to that later on. Only when you defecate and it goes back in, sometimes throughout. Another thing you notice is there'll be pain around your anus. Another thing is you might be itchy, making you want to scratch it. And another thing is you have this feeling of incomplete emptying of your bowels. So you're at the toilet bowl, you finish defecating, but you still feel like there's something within that you haven't defecated out. That is another symptom that you notice.
Well, thank you. Now, does this thing come with pain? The swelling, this blood that comes with the poo, does it come with pain?
Okay. So, like I said earlier, I was talking about some swellings that come out when you defecate and some that are just there throughout. So let me just branch quickly and just use a stone to kill two birds. There are 4 grades of hemorrhoids, of piles. Okay. The first one is hemorrhoid is inside your anus. So you don't see it, you don't feel it. Those are usually painless. The second, when the hemorrhoid comes out when you defecate, but goes back itself on its own into your. There's only when you defecate, it comes out. When you're done, it goes back in. The third symptom is a swelling that is outside your anus, but you can push it back in with one finger. Then the 4th grade is this pile is bigger and it is outside your anus and it cannot be pushed back in. So you were saying that, do these swellings come with pain? When you're already at the grade 4 stage, most likely you would have pain. And most likely the bleeding would be more and it will also be painful.
So what causes the progression from level 1 to level 4?
When it starts off at grade 1 and it is left untreated, that causes the progression. And the persist, you are still constipated, your diet is still not uninclusive of high fiber content, as you said before, fruits and vegetables. You are still straining hard in the toilet, or there's still the presence of something in your abdomen that's increasing the pressure. These are the things that make piles progress from grade 1 to 3 to 4.
What you mentioned just now gives me a question. Does it mean that pregnant women
Exactly. But I am not saying that all pregnant women will have pile. And when we say pregnant women, we mean the women that have gotten pregnant multiple times. We call them multigravida. So these women are at greater risk of developing piles, but not all pregnant women will develop piles. They are just at a greater risk of developing piles. The good thing about this is once the baby is delivered, the piles go back on their own.
Oh, okay. What about people who have a job that requires them to sit for so long?
Requires them to what?
A job that requires them to sit for so long. Maybe corporate workers who are a typical 9 to 5 and they're on their seat for so long. Can that be a risk factor for piles?
No, not that I am aware of, no.
Oh, okay. Interesting. I'll quickly take this message from Chimezi and then we go on to the other questions. He said, since sugar doesn't cause jedi or diabetes as fondly believed, then can we eat our sugar in peace since it doesn't predispose people?
So yeah, I am made to believe that jedi is what we call pile, is the local term for pile, not diabetes. What you have a genetic hereditary predisposition to diabetes already. And if your dietary habits are not aligned with that, if you still go on eating like someone who doesn't have that genetic or hereditary predisposition, then the likelihood that you develop diabetes mellitus is high. But we're talking now about sugar being a cause for pile, and that is a negative. That is no.
All right, now you know the balance, Chimeze, please work in it. Thank you. All right, so let's talk about the treatment. Since you said if grade 1 is left untreated, it could progress to grade 4. How is piles treated?
Okay, so the first thing I like to say is pile, especially grade 1 piles, and which is why everyone should just incorporate this into their lifestyle, is diet. If you have with one pile and they start to incorporate high fiber diets, lots of fruits like we mentioned, mangoes, bananas, red apples, lots of vegetables. We can have grain, brown rice. into their diets, that grade 1 pile can regress, can go back on its own. But if it has progressed, so let's say grade 3 or grade 4, then we have some other alternative, non-surgical and some surgical. The good thing is that piles have been treated for so long that now the complications of surgery or even the non-surgical methods are less than 1%.
Okay, let's start with the non-surgical and then we'll proceed to the surgical. How do you give a non-surgical treatment to piles? I'm just curious. And also to let someone know that once you have piles, it is not something that totally hampers your quality of life or that's the end. Because I know how they used to scare us with, if you eat too much sugary things, your bum bum will come out, that kind of thing. All right.
Okay, so the first non-surgical I'd like to say is we have what we call suppositories. These are drugs that instead of taking them through your mouth, you put them into your anus. Suppositories. And you can do that yourself or you can have a trusted person do that for you. So we have, and this is usually used for grade 1 to 2 piles also. Then if the pile is bleeding, or if you're experiencing profuse bleeding, that is a lot of bleeding, then you go to your nearest health facility, the doctor will just inject something into the pile to make it become smaller and to make the bleeding stop. We call that sclerotherapy. Okay. Another non-surgical alternative is what we call the rubber band ligation. We just put a band at the base of the lump of the swelling of the pile, and then it shrinks and falls off on its own. Those are the non-surgical treatments that we have.
Interesting, but I find alarming that one that you have to insert something up your, nah. So for the surgery,
easier to do. It sounds scary, but the first time, you just lie down and you do it yourself, or you have a loved one do it for you, and it's.
Did you say the first time? It's more than once?
Yes. No, I'm saying like you said, it sounds scary, and I'm saying that after you get well adjusted, it's not as scary as it seems. Yes.
So it's a drug that you have to constantly take?
Yes. It's not just once.
Okay. Then what about the surgical intervention, at least?
Okay, so in surgical intervention, we have the hemorrhoidectomy. We previously said that piles are also known as hemorrhoids. So hemorrhoid means the removal of hemorrhoids, the removals of piles. So it's a well done, a commonly done procedure. So there's no problem with that. Complication rate is very low, it's like less than 1%. So it's not really scary.
Do you operate on your anus?
I guess. Anus.
Wow, that picture is not pleasant in my head. It's not. But if you have any question, we have about 3 minutes to take your questions and your calls. 0809-444-0981. Again, 0809-444-0981. That is the WhatsApp line, and that allows us to read your WhatsApp messages. But if you want to call, 01-448-9981 is the number to dial. 01-448-9981. I can only take one call and one more message, because this is from Peter from Festac, who says, "Good morning, my people. Thank you for the health session this morning. This is the reason why self-medication is a major cause of illness amongst Nigerians. Thank you, Sheila, and thank you, doctor." Well, you're very welcome, and we are glad that this is very helpful, because self-medication is, in fact, the cause of many, many, many issues. On your own, you are probably fine, and you just need to have one drug or the other from a certified physician, and before you know it, you are self-medicating and then complicating things for yourself. I think we've touched on the major things to be known about piles. Is there any other thing we're leaving out? Is there?
Also, just preventive measures to against.
Yes, preventive. Okay.
Okay. So I like to call them the LLDD. LL. Okay. The first one, like we said, lots of fruits and vegetables. Eat your vegetables, don't drink them. The second one, lots of water. The way fiber works, the way fruits and vegetables works, they soften your poo. But they do that by drawing, they also do that by drawing water to the poo. So you need to help that process by also ingesting a lot of water. I tell people, if you take sachet water with each meal and you're eating 3 meals a day, take 2 sachet waters per meal. That's like 3 liters of water a day. And that is sufficient for you. Anything less than that is insufficient for a grown 70 kg adult. Then I like to say the first D is don't push hard when you're on the toilet. Don't push hard. The second D is don't lift heavy objects frequently, because that increases, like we talked about, the pressure within the abdomen. And that is a big predisposition to getting piles.
What about those who are constantly in the gym lifting heavy?
I think they are posture.
Oh, okay. Okay, so the posture works hand in hand with the...
Most people, when they want to lift heavy objects, they just go down on their, they bend their backs. They don't bend their knees. And then all the pressure, yes, you have to distribute it equally on your knees and on your back. Okay,
that's also another thing. That's true. The way a number of us lift heavy objects, it is not healthy. Okay, now you hear that. Not only is it a risk factor for piles, I think also you can have a slip disc while you are lifting that thing, and you could strain or strain a muscle in your back or a nerve. I don't know what it is now, and you could be hurting your back. So please be careful how you lift things. I think you have to go down as if you want to have a squat and then bring it up.
Yeah, that's the proper way to lift. Yes,
I'm a good student. I am a very good student. I know that. On YouTube, Oluwaseun says, great piece of information at Dr. Adejuyigbe. Thanks for sharing. And thank you all for listening. Thank you for your comment and, of course, your feedback. We appreciate all of you that were there. We are done for today because the time is over. We are out of time, but that was actually very helpful and informative. Thank you for your time, Dr. Adejuyigbe. Is there any way we can find you on social media?
Yes, I am on Instagram. My name, if you search Dr. Niiyin, my name is spelled Niiyin. You'll find me on Instagram.
Dr. Adejuyigbe Niiyin.
Yes, or if you just search for me, you find me. I'm literally the only one in Nigeria with that name.
Yeah, it's the first time I'm hearing Niiyin. What does it mean?
It means praise. My full name is Oluwaseun.
Ah.
Yeah, that was my name. We say Oluwaseun. Gods, yes.
Nice. Well, nice to meet the only Niiyin in Nigeria, at least for now. Chances are that now that somebody has heard it, they might go name their child Niiyin. Thank you for your time this morning. It was a lovely one. Thank you. If you're just joining us, we are done with this conversation, but do not worry, we'll save the video for you on YouTube so that you can go there and watch. And please remember to share with your family and friends, because piles is not JJ and you do not get it from eating so much sugar. In fact, I am of the opinion that one of the reasons you think it comes with back pain is because of your sitting posture. And when you stay on the phone, there are, my generation, we like to stay on the phone in the toilet. In fact, some people will not go to the toilet without their phone or something. That is not so good for you. So please stop it. It could just be increasing the risk factor for yourself for developing piles. And it is easy for you to get treated for piles. So again, if you seem to have it already, it can be treated and dealt with. Thank you. And thank you again for your time. We're done for this session. We will be back 8:40 to have a spelling session with the kids. So tell your children, as long as they are between the ages of 6 to 15, to be a part of it, because then it will be the time for Curious Minds on Smooth 98.1.
And the rest will follow.
Thank you. That was a very lovely session. I enjoyed it.
Question.
Thank you. So enjoy the rest of your morning.
And you also.
Bye.
Body, healthy life. Soul food on Smooth 98.1.